breaking bad news. Whenever we have got this kind of scenario, breaking bad news, you will see most of the time the question is going to be quite lengthy as well. Why? Because a lot of information will be given to you in the question itself. For example, what is the situation of the patient at the moment? Why the patient is in this situation? What is the management plan? So you will see everything is given to you in the question. So first thing that you need to do is make sure you read the question carefully. Because if you even miss one line, the station may not make sense inside the cubicle, right? So you have to be very, very, very careful that you read the scenario carefully. I know there might be too much of information and you might think that 1.5 minute may not be enough for me to read that task, and I wasn't able to retain the whole information. So what you should do when you go in, I would say there is no hesitation that you should have in your mind in case you want to see the task again, right? So this is really, really important. Yeah. Now, breaking bad news, we follow Spikes protocol. What we do, we follow Spikes protocol. So what is the Spikes? Spikes is S is setting, then P is perception, then we have got I is invitation, all right? K is knowledge, and then E is emotions or empathy. And then we have got S is strategy or summary. So if you know Spike's protocol, you will not have any trouble in doing any breaking bad news scenario. All right. I'll discuss it and make sure, in these scenarios, you have to take care of these couple of things as well. Voice control, make sure you are soft spoken. This is really important. Many of us, maybe most of the times, I'll say mostly male candidates, they might not be that much soft with their tone. We need to work on it. Yeah. Record yourself, practice in front of the mirror. These things will definitely help you out a lot. But make sure, guys, in the exam, you are soft spoken. Eye contact, make sure you give proper eye contact in the exam. You will see like patient might not be giving you the eye contact. That can happen. Patient is looking here and there because patient is not comfortable, isn't it? Or for example, in breaking bad news, you're talking to the relative. They might not be in a state of mind to give you proper eye contact. They're just worried and looking here and there. So that can happen. A lot of things you will see that may happen, right? But we need to be very, very careful that we as a doctor, we are giving proper eye contact to our patient. What I mean by nodding is, many times you will see our patient is talking a lot. Our patient's relative is talking a lot. So what do you do? Obviously, we cannot interrupt the patient in between. We cannot interrupt, but what can be done? So you nod. So the patient is talking for a very long time. You give them active signs of listening. Without interrupting them, you tell them that I'm listening to you. So how you do that? By nodding your head. Okay. Yeah. So that is really important. When you do PLAB to a station, it's not about just talking, it's about your whole body should talk. Your body language is very important. Body posture is very important as well. It depends, what kind of patient that you have got. Sometimes you will see patient, maybe in breaking bad news or maybe it's an angry patient. What can happen? They can shout and they can come close to you. For example, you gave the news and they just burst into anger. That can happen, isn't it? So in anger, they might come close to you. So what do? You go a bit back on your seat. What do? You maintain the same distance. That is what I meant by body posture here. So be very careful about these points, right? So what you know is breaking bad news. We have got Spikes protocol. So let's go a bit into this Spikes protocol. Let's discuss it a bit more in detail. And then we'll be going through some scenarios as well. So setting, S is setting. Setting means a comfortable room, sitting, no interruption. Perfect. So what happened? In real life, what happens? Obviously, you have a comfortable room. Usually we take the patient maybe in the staff room when we break the news, isn't it? Because it won't be a good idea if you break the news, for example, say in the ward, in the general ward. There are other patients as well. So it may not be a good idea, isn't it? So we take the relative, we take the patient to a comfortable room. That's really, really important. Obviously, we make sure the relative patient they're sitting, and obviously there should not be any interruption. That's why I said in real life, what we do, we take them to the staff room, for example. Here in the exam, what's going to happen? Obviously, there won't be an interruption. Obviously, you'll have a comfortable room. It's a separate room that you're having, isn't it? The main thing that you need to be looking for is sitting. What I mean by that, when you enter into the cubicle, sometime you will see the patient or the relative. I mean, they are standing. So now tell me, can you disclose the news? Can you break the news in standing position? Not at all, not at all. Because if you do that, you will have another breaking bad news, I would say, because the person you're giving the news might collapse there, isn't it? So you have to be very, very, very careful what you do. You make sure the person you are giving the news is sitting. All right. And the first thing that we do in every single scenario is we introduce ourselves and we identify our patient details. You need to do it here as well. But sometimes what can happen? You entered into the cubicle, and what happened is the first thing is patient jumped at you, and patient is like, "How's my father? How's my son? How's my daughter? How's my wife?" So they might ask you a question straight away. Now, and patient is standing. So what we need to do? Patient is standing, and they didn't let you introduce yourself, and they just asked you a question. Now, I've seen a lot of candidates might be saying they just introduce themselves there. "Hello, I'm John, one of the doctors. May I confirm your name and age, please?" Do not do that. See, they have asked you a question. The first thing that you're going to do is you need to answer their question. The question was, "How's my wife? How's my husband?" So the answer for that question is acknowledge their emotions. "I can see you are concerned. I can see you want the details about your wife, and I'm here to discuss everything about your wife." All right. First of all, it would be great if you can have a seat, then we can discuss it. They will sit, you will sit, and then what you do, you will introduce yourself. "By the way, I'm John, one of the doctors here, and are you Mr. Ali, the husband of our patient, Maria Ali?" "Yes, doctor." And then only you will start the station. So this is really important. First is setting. Comfortable room, fine. No interruption, fine. That is definitely going to be there for you. But sitting, make sure your patient is sitting. That is really, really, really important. Then only we'll be breaking the news. Yeah. So that's first is setting. Then we have got perception. Perception is assessing their knowledge. So you need to assess their knowledge, how much they know. Many times you will see what's going to happen. They're forcing you, isn't it? "Tell me what's happening. How's my husband? How's my wife? Is everything all right? Is he going to be like, I mean, is he going to be okay? Is he going to be the same as before?" So they'll have a lot of questions. They want the information quickly, but make sure in the beginning you will not give them any information. What you will do, you will assess their knowledge. You'll ask them some question. What question you're going to ask? "What do you know? How much do you know? What exactly happened? Tell me, why did you bring him to the hospital?" I mean, you need to have that background story in their language. I mean, what I mean to say is, see, you have to give 100% information to your patient, right? But they already know. You have to give 100% information to the relative. They already know 50% of it. So why you want to start from first? Why should we not start from number 51, isn't it? I mean, they already know 50% of it. So that is what we are trying to do here. So before we give any information to them, what we do is we assess their knowledge. We simply ask, "How much do you know? What exactly happened? Tell me, why did you bring him to the hospital?" So what's going to happen? They will give you the story. They will give you the background, what exactly happened. For example, I would say, I mean, I was just sitting, at home, and all of a sudden, I don't know, he just collapsed in front of me, my husband, and I don't know what to do, and I just called the ambulance, and I got him here. For example, that is the story there that they narrate. Now, what you need to do when you have to give the information, when you have to break the news, what you do, whatever they have said, I want you to reflect it back. Whatever they have said, reflect it back, meaning say it again. "Okay, Maria, as you have said, you were at home, you were sitting there, and then you said your husband, all of a sudden, what happened is he collapsed. And then you called the ambulance and you got me here, right?" So reflect it back. That is really, really important. Reflect the patient's statements. That's really important, right? And now, if the situation allows, for example, if needed or the situation allows, maybe you can take a bit of history as well. Now, the question comes, I've seen a lot of students, a lot of doctors, they go in too much of detail of the history here. See, guys, you need to understand the aim of the station. The aim of the station is to break the news. The aim of the station is to break the news. So do not go into uh, too long history. I mean, if you want to take, for example, patient collapse, patient is an elderly patient, patient collapsed because patient has headache and then collapsed. So we know there might be some reason of that, right? It could be like high blood pressure, high blood sugar. So there can be many reasons for it, isn't it? So if you want, you can take maybe one, two question in the history, but please make sure you do not go into much of detail. And most of the times, as I said, the question is going to be quite lengthy. So most of the time, why this patient collapsed, the reason will be given to you in the question itself. So you do not need to go into the detailing of the history. Be quick there, because I said, you do not have to disclose it in the first minute, because you need to assess their knowledge first. Once you have assessed the knowledge, you have got enough things to carry out your station. So please go and disclose the news, disclose the information to them, so that you will have enough time in the later part of the station to address their concerns, to address their concern, because they'll have so many questions for you, isn't it? And if you don't have time to answer, then we won't get marks for the management, isn't it? Management is addressing the patient's concern only, right? So first, what we did, setting, patient is sitting, perception, you assess their knowledge. How much do you know? What exactly happened? Why did you bring him here? And then what you do, you reflect it back. Whatever they have said, try to reflect it back. Okay. And then if needed, you can take maybe one, two question in the history as well, maybe past medical history. Now, you need to give the information in layers. You have to layer it down. You cannot give the information in just one go. You need to layer it down. You need to prepare the patient for the news. You need to give them the time to digest the news. So you have to prepare. How are you going to prepare? Put some layering, give some warning shots to the patient. So what we mean by that? For example, you invite the patient for the information. You ask the patient, would you like to have someone beside you? Would you like to have somebody beside you before I tell you the news? What does it mean? What is the meaning of this line? When I tell to somebody, when I mention this line to someone, would you like to have someone beside you before I tell you the news? It simply means there is something wrong. I mean, there is something major has happened. Again, the patient reaction would be when you say these things is, what do you mean? Is everything all right? Now what you do, put another layering. Tell them what you have done. In sequence, we need to go. Tell them what you have done. For example, the task says we have done the scans and the patient has got bleeding in his brain. So we have, as you got him to the hospital, you said that he was having headache and you got him to the hospital. In the hospital, we did some examination. We did some investigation as well. We did a CT scan. Put another layering, guys. I don't have a good news for you. I don't have a good news for you. I have a bad news for you. See, the meaning is same. I don't have a good news for you. I have bad news for you. The meaning is same. There's no difference, right? But what you are supposed to do, you need to use some good words, positive words. I know there is nothing positive in breaking bad news, but still go for positive words. I don't have a good news for you. And I'll tell you what is the most difficult thing. What do you think? What is the most difficult thing in breaking bad news? What I think is to give the pause. Whenever I do the station or I practice the station with the doctors, I've seen most of the candidates, they just keep on talking. They keep on talking. No, pausing is very important. You need to give enough time to the relative to digest that news. And if you don't do that, station will not make sense. You will not be able to have that much of rapport with your patient. You will never be able to have that rapport. Okay, so what you need to do is pause, give the information, pause, let them ask you question, and then you answer accordingly, because it is patient-centered consultation. So what you say, we have done a CT scan. I don't have a good news for you. What does it mean? How they're going to react? They're like, what do you mean? Tell me, doctor, is everything all right? Is he okay? Can I see him? Then give the information. I'm sorry to tell you that he has got bleeding in his brain. What you do, pause, 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 pause. That is most important. So you pause, right? So what you have done is you have given the information to them, right? I'm sorry to tell you he has got bleeding in his brain, and then you pause. For how long you need to give pause? I don't know. You have to see the scenario. For how long you're going to keep the pause, right? So what we have to do is we have to see their reaction, because the way a person is going to react will be different, isn't it? It is like how the examiner, they have trained their patient for that particular day. So for example, the examiner said in the morning, today you have to cry. So they'll cry for everyone. They'll cry for all the candidates for the exam. Today you have to go in denial. So they will go in denial for everyone. Today you have to be a bit angry. So they will be angry for everybody for that particular day. So it's really important, right? So whatever is their response, your response has to be accordingly, isn't it? I mean, I've seen a lot of doctors, what they do, they are like, okay, in breaking bad news, you have to offer a glass of water, you have to offer tissue paper, that's for sure. No, it doesn't work like that. You have to see the scenario, how this scenario is going, isn't it? You need to see if this patient is crying or what exactly is happening. So, for example, a patient is crying, what is the best thing that you can do is let the patient cry. Let the patient cry, right? Give them enough time to digest the news. They need that time, right? After some time, you can offer them tissue paper. That will be there beside you in the on the table. What else you can do? You can offer them a glass of water. That will be there also there, right? So this is something that you need to do. Offer them tissue paper, offer them a glass of water. Now, can I touch them? Can I just stand and just pat or tap on their shoulder? No, in the exam, no. See, in real life, what happened? What happens in real life in the hospital is different, obviously, from the exam. So, in the hospital, what we do whenever we break the news, we most of the times we take our staff with us as well, and they are there to do all these things. I mean, uh, they are there to do this, for example, just to tap on their shoulder and also they do that. That's quite normal. There's nothing wrong in that. But in the exam, are we gonna do that? No, you are not gonna stand from your seat to go to them and just tap on the shoulder. You will never do that. You have to be very, very, very careful about that. No touching in the exam. All right. So now, if they are crying, you offer them a glass of water, you offer them tissue paper. Sometimes they can go in denial as well. They're like, no, what you're saying is not right. You may not have checked him properly. You may not have checked the CT scan properly. Just go and show it to a senior doctor. I know he was fine. He will be okay. So what they're doing, they're going in denial. So they will have different way of doing things. They have different way of acting for every single day. So how are you gonna react to that denial? You can acknowledge, I can see that this is a big news for you to take in. And I'm really sorry that I'm the one breaking it to you. I wish I would have had some better information. But the thing is, this is the truth. We have done the scan. Even our senior consultants, they have seen the scan report. And all of us, we have come to a conclusion that he has got bleeding in his brain. So this is how you're going to explain. So I don't know how your patient is going to react, and howsoever they will react, you need to do things accordingly, right? So this is really, really important. So sometimes, and another thing, sometimes the reaction that they will give is very cold as well. I've heard like sometimes their reaction is very cold. What I mean by that, uh, when you give the information, like he has got bleeding in his brain, and the reaction is, oh, bleeding. So what are you going to do? I mean, you do not expect this kind of response from them, isn't it? So what you do, you just go and do it. And I've seen a lot of candidates, they come and they ask me like, no, today the Breaking Bad news scenario, the actor was not a very good actor. I was like, why? He wasn't shouting, he wasn't crying, he wasn't going in denial. He was just like, what are you gonna do? I mean, this is what happens when you don't care about your dear ones. I mean, it can happen. I mean, for example, in the UK, you will see after you are turned 18 years, you are not going to be staying with your parents or your grandparents. You might be staying alone. So when their parents or grandparents might be in a situation like this, like they have got bleeding and all, they might not react that much. The reaction can be, oh, he has got bleeding. So now what? What's the plan? What are you going to do? So they might react in that way as well. And that is real. They're showing you the reality of the situation that happens in this country. All right. Don't think they're not good actors. All right. If they're angry, what they're going to do? Sometimes what can happen is they might start blaming you. No, it's not possible. When I got him, it was fine. So what you need to do, acknowledge their anger. I can see you are upset. I can see you are upset to see your husband in this situation. I know it is a very difficult situation for you, but this is the truth, Mrs. Ali. The thing is, when you got him here, as you mentioned, he collapsed at home, and when you got him here, we did everything what we could have done. But the reason of bleeding could be anything. The reason of bleeding could be like he has got high blood pressure, as you said, he's having high blood sugar, as you have said, and all these things, all these risk factors, they are the contributing factors here, which can lead to the condition that he is in at the moment. So it depends. I mean, whatever is their reaction, you need to deal with it accordingly. All right. Yeah. So setting is done, perception, invitation, you give them the knowledge. And the most important thing, as I said, is the pause, pause, pause. I've seen a lot of us, what can happen is we now force our patient to give the management. See, sometimes what happens is patient or the relative, they're not much interested in knowing the management at this point. The management is, for example, they have said it is palliative care, but they might not be interested in knowing about the palliative care at the moment. They might be more interested in asking some other question. They might ask you some challenging question. For example, when you have said he has got bleeding in his brain, is he gonna die? Is he gonna be okay? How much time he has got? So they will have these challenging questions. I've seen a lot of candidates, what they do, they just uh, want to give the palliative care plan. They just want to give the treatment plan. No, it is patient-centered consultation. So let the patient ask you question first, and then you will just answer them accordingly. For example, the scenario is a patient was brought in the hospital by the wife because patient has got bleeding in his brain, right? And in the hospital, we did this scan, and the scan shows patient has got bleeding. And the team of doctors, we have decided we cannot do active treatment, we cannot do the surgery, and we have decided only palliative care will be possible. So that is what is given to you in the question. So when you go in, you did the setting, you did the perception, you did invite the patient, you give them the information that he has got bleeding in his brain. You give that information. Now, the question, there are a lot of challenging question that is gonna come from their side, and I'll answer all those challenging questions. Just give me a sec. So emotions and empathy. Is emotions empathy? I think the whole scenario is about emotions and empathy, isn't it? And the strategy and summary, whatever is your treatment plan, you can just mention. For example, I said palliative care is decided for this patient. So what you do, you just give palliative care plan to your patient, right? Or to the relative, I mean. So this is what you need to do. Now, I was saying there can be some challenging questions as well, right? So I'll discuss those challenging questions. The challenging questions could be, is he gonna die? The challenging question could be, how much time he has got? It is very difficult for anybody to answer these questions. Is he gonna die? How much time he has got, what is the treatment, why are he not doing the surgery? So there are lots and lots of things that is happening here, isn't it? So you have to be very careful how to answer these questions. I'll be telling you all these things how to answer. Meanwhile, I just want to know, like, if you can write down maybe in the chat box what can be the answer of these questions, and we'll discuss. Palliative care. What do you understand by palliative care? Palliative care is a kind of a medical term, I would say. I will use the word that we will be doing everything for your patient to make him comfortable. That is what palliative care is. Palliative care is to make the patient comfortable. That is it. So palliative care is different for different patients. I've seen a lot of doctors, they just generalize. Palliative care means for everyone. No, palliative care simply means to make the patient comfortable. And the requirement for one patient would be different from the another patient when you're talking about palliative care. All right. So in palliative care, usually what we're doing, we might be putting NG tube, we might be putting PEG tubing, we might be doing catheterization, changing the position of the patient for the bed source, doing some physiotherapy, your joints will not become stiff. I mean, putting some eye drops as well, so the eyes will not become dry. So there are a lot of things that we can do when it comes to palliative care, isn't it? So we have to see what is the requirement for this particular patient, and then you are gonna go accordingly, right? So what we have in Breaking Bad News is the spikes protocol. Spikes: setting, perception, invitation, knowledge, emotions, and strategy. So first, make sure your patient is sitting. There is no interruption. Before you give them the information, you ask them what exactly you know. Tell me what happened. Why did you bring him to the hospital? And then what you do, whatever they have said, you reflect it back. If needed, you may be able to take a bit of history as well, but do not spend too much of time. Then you layer it up and you give the information. How you can layer it up? Okay, when you got him to the hospital, we did some examination. We did a CT scan as well. I don't have a good news for you. Pause, 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 pause. Would you like to have somebody before I tell you this news? Pause, pause. And then you give the information that we have done the scan, and the scan shows he has got bleeding in his brain. And you do pause. Now wait, how they're going to react. Like they're crying, they're going to be in denial, they are just taking it very lightly. I don't know how they're going to react. So howsoever they react, you have to go accordingly. All right. And then in the end, whatever their questions are, you just answer their questions accordingly. Is he going to die? Uh, I can see you are concerned, Mrs. Ali. It is very difficult question for me to answer. What I want to say is he is in difficult situation. He is in critical situation. He is in terminal stage. We are not expecting him to get better. Do not say yes, no, yes, no. If you say yes, no, you can move on to the next station. It's not going to work. What you need to do, you need to say few lines. That's how you can counsel other person. I'm not telling you to give the false reassurance. You're not giving the false reassurance as well. But you're not saying yes or no as well. Is he going to die? Yes, he's going to die. You will also die in the station. So you have to be very, very, very careful. How much time he has got? Uh, I can see, Mrs. Maria, this has taken a lot of toll on you. The thing is, it's a very difficult question for anybody to answer how much time he has got. The thing is, he's in a very difficult situation. We are not expecting him to get better. And the situation he's in, there are lots of complications which can happen. You know, he can have bleeding again. He can have some simple complications like infection, like pain. That we can manage. We can give him painkillers, we can give him antibiotics. But as I said, bleeding, if it happens again, it might be life-threatening as well. The thing is, the explanation that I'm giving is it means he's gonna die, isn't it? But we're not saying he's gonna die. See, everybody's gonna die one day. But it won't make sense if you say, yes, he's going to die. No, he's not going to die. No, he's having 1 week. He's having 1 month. You are not supposed to say any of these things. You have to be doing it in this way that he's in critical situation. He is in terminal stage. We are not expecting him to get better. Complications can happen. Some complications we can manage. Some complications can be life-threatening as well. And you know, all these things when you say it with some emotions as well. Because if you just say, yeah, we're not expecting him to get better, he's in critical situation, and your body language is like, you don't care, don't do that. So we have to be very, very, very careful about these things. The way you say things is going to be very important. PLAB 2 is not what you say, PLAB 2 is how you say things. That is the main important part here, right? So this is the main thing. So this is your breaking a bad news, and what we discussed was Spike's protocol. All right, I hope it helps.